One of the most common questions that I hear when I'm seeing a patient who is in the office to be evaluated for implants, whether they have implants already or they're looking to have breast implants placed, is what's the deal with above or below the muscle? Very common question, and it can be incredibly confusing. One of the most common advantages with below the muscle implants are that it lowers the risk that scar tissue will envelop the implant and cause it to feel hard, and also move the implant upward in an unnatural position. In addition, under the muscle implants provides more tissue to camouflage the upper part of the implant so that it's less noticeable to the eye. So those are the two primary advantages with below the muscle implants. Now let me show you what the disadvantages are, because there are issues to consider as well when the implant is below the muscle. The implant tends to wiggle when you contract your pec muscle, and it looks unnatural. In addition, for those who like to work out and lift weights and strengthen the pec muscles, the implant will slide upward and also feel hard. So it's not particularly a great idea in a woman who likes to lift weights, to put the implant below the muscle. And in addition, a below the muscle implant also is more likely to bottom out because it's under the muscle. The muscle detaches and the implant slides below the breast fold. And so those are the primary disadvantages. Now let me talk to you a little bit about above the muscle implants. The advantages are it's an easier postoperative recovery because the muscle isn't involved, it doesn't hurt as much. It provides a slight lifting effect on the breast. Therefore, someone who has mild sagging, not severe, the implant can actually lift the breast just a little bit. So less likely to need a breast lift in that circumstance. Patients who like to lift weights are able to lift weights because it doesn't really alter the position of the implant at all. And it's less obvious when contracting the pecs if the implant's above the muscle. It doesn't wiggle the same way as the implant wiggles when it's under the muscle. What are the disadvantages with putting the implant above the muscle? First, it's easier to see the edge of the implant. It's more noticeable in women who are very thin and have very small breasts. So generally speaking, a thin person with an A cup or a small B cup breast is probably a better candidate for under the muscle. There's a moderately higher capsular contracture rate, that is scar tissue enveloping the implant and causing it to feel firm and distorting its position when the implant's above the muscle. Except that doesn't seem to be the case with the newer implant that we're using, the Motiva. It's a tremendous advantage with the Motiva implant because it can be placed above the muscle, which gives us an alternative for a location to place the implant in women who have enough tissue to camouflage it. Again, in a thinner patient with very small breasts, it's easier to see the edge or even a ripple in the implant in the upper part of the breast. So that's a overall review and summary of the advantages and disadvantages. The most important thing is each patient has individual characteristics that dictate the recommendation as to whether to place the implant above or below the muscle. And those can be reviewed, and a good recommendation that takes into consideration the anatomy, the stature of the patient, and what their lifestyle is, so that we can come up with a good plan for each individual patient. Thank you.